tell my patient it's going to take a few minutes to set up, so you just relax. We're going to go ahead and put her in a position, a lithotomy position, and at a later date I'll show you how to wrap the legs. They had that poor woman totally exposed. You should have her legs draped as well, so that the only part that's covered is this. And I like having this side rail up to hold my trash bag in place. And we have these, if you wonder what this is just a little support to hold the mannequin steady and in place. Now, when you look at your kit, usually it's taped on the bottom, the first flap, and you want to open the kit away from you. Okay? So I'm going to untape this. I'm going to open it away from me. Then you're going to have the two sides, side, side. If they have a tendency to spring back into place, usually, and you can turn this because I can touch the bottom. Usually if you pull adjoining corners, side by side corners, the last one I'm going to pull towards me. Okay. You see how?
Of course, this is going to be between their legs, right?
Right. Which you think about this, and that makes it hard, doesn't it? I mean, this is very easy because she's kind of chopped off right there. And we can move this back and forth. I can have it here. I can have it here. But do you see how this is kind of sticking up? If I come over here and I pull the two, look at that. Isn't that beautiful? How it lays down flat. Now, the nice thing about a Foley kit is you have everything you need within this box. And you must touch everything in this box before you touch the patient. Okay? So if you keep that in mind, you'll be okay. The first thing is a drape. And this is the drape that's going to go up underneath the patient. And in order for me to get this drape up underneath the patient, I'm going to need to scoot this back a little bit because I'm going to be leaning over right here. And on the video, they contaminated that drape all over the place. Yeah. Looking at the drape, can you see that it has a dull side and a shiny side? It has a little corner folded over. You can touch it on one of the sides, but don't touch it on both. All right? And it doesn't matter to me whether you touch the dull side or the shiny side. I'm going to touch the shiny side. And you want to pick this up just like you did with your sterile gloves and kind of step back. And we want to open it up. All right? And I like telling you to hold this like you would hold a large pizza. I'm going to hold my pizza so I'm not going to dump it on the ground. If I were holding it like this, I would dump my pizza on the ground. Okay. And if you have a hard time grasping this paper, if you fold it together, you can grasp it. But I have not touched the dull side, have I? Okay. So now I'm going to put this up under my patient. I've slid my sterile field out of the way. I'm going to say, Ms. Jones, I need for you to lift your hips for me and get it up underneath her. Those of you who are neat freaks, don't touch it. Okay? What is the purpose of this drape? It is sterile. That is sterile. It's protecting what? The sheets from the betadine as we're cleansing the patient. So it doesn't have to be beautiful or pretty. But that is sterile, and this is sterile. So now I like bringing my sterile back. So now I have sterile to sterile. So now my sterile field is this big. You see that? Next, what do I have? Gloves. Okay. When you pick up your gloves, remember, you don't want to touch anything up underneath. So kind of pinch your gloves and bring them over to the side. And then you can put your gloves on. You can put them on over the bed table. Make sure you don't cross over your sterile field. You have to. Okay. You have to be able to get into the box. Okay. But that's a good point. thumb out of the way. That's right. All right. Is that still sterile?
Yes.
Yes, it is. So I can take this and I can put it here and make my sterile field even larger.
But you're going to be reaching
Just
over
only
it?
reaching over it.
That's good. Well, I can come right here. What do I have next? Another drape. Now, I have on sterile gloves, so I can touch anything in here that I want, correct? So I'm going to get my sterile drape. This is called a fenestrated drape, and it's called fenestrated because the French word for window is fenestra, and you have a little window there. And you see where it has the cutouts for the legs on the side? Do you see how I've kind of got it turned to protect my sterile gloves? I'm gonna lay that right there. I don't care if it's pretty. I could go up underneath that and straighten it out. I'm not going to touch the side that's next to the patient. Why?
That's non-sterile.
Because it's contaminated.
Ms. Klauber,
Yes.
since you still have the towel there,
Right.
how are you going to move it without using your sterile gloves to touch that towel?
I kind of had it out of the way, but I didn't get it far enough out of the way. But I'm going to have to contaminate one hand.
Okay.
That's when I'm going to move that out of my way. Okay? Now, you have a tray on top of a tray. So I'm going to take them and separate them. You have a specimen container, and you can set that aside. You can leave it in the box. All right? But just make sure that you don't contaminate your gloves when you're moving that. Then I have my iodine swabs, and I can go ahead and open these. You see how it has the little perforations about right here on either side. Once you tear that, the sticks will protrude up out of the top. And then I like placing that right inside there so I can reach them. Then you have your lubricant, your water-soluble lubricant. You're going to open that and squirt it wherever you want. I'll put it right there. Now, I could throw away that in my bag, or if I wanted to, I could just drop it because it's still sterile, right? Sometimes trying to get something into that bag is, you can contaminate. So, either way, as long as you don't contaminate. Then we have our sterile water. And guys, this does have a little cap on the end of it. So make sure you remove the cap. So I'm going to take that off. I need to go ahead and plug it up to the port. And this has a little plastic sleeve on it that you have to pull off. When you're pulling this out, make sure that you ease your catheter out. I'm going to pull it out. You don't want it like this because you see how it could easily hit my uniform. So ease it out of that sleeve. And I'm just going to drop this because that long sleeve, I can imagine contaminating trying to get it into the trash bag. So I'm going to attach my port. Okay. And then I want to put the end of my catheter tip in the lubricant that I squeezed out. And sometimes you have to work with your catheter because it wants to go where it wants to go. So you may have to make some adjustments to get it where you want it. Okay? Now I'm ready to clean because I've touched everything in there, correct? There is a little label for your bottle. I'm not even going to worry about that. So now I'm going to take one of my swabs and say, Miss Jones, I'm going to clean you now. Now, in the video, they showed doing perineal care prior to. If you need to do perineal care prior to doing the catheterization, you certainly can do that. I'm going to contaminate my non-dominant hand. So I'm going to touch you, and you're going to spread the labia. When you spread the labia, use the side of your thumb and the side of the finger, spread and pull upward. All right? Once you get that non-dominant hand in place, do not move it. Because if I let go and the labia close,
Just recontaminated.
It contaminates and I have to start all over again. And I don't have another kit. So I'm going to spread the labia, holding it open, take one swab, distal side, drop it in my bag. Proximal side, drop it in my bag. And the nice thing about the bag being here is I'm not having to bring it back across my sterile field. The third swab, down the middle, drop it in the bag. Now we're ready to insert. If I have a hard time seeing that urinary meatus, like Mr. Collins was speaking of, you can have the patient cough while you're looking, and that little meatus will wink at you.
All right.
Yeah. Okay.
That's smart.
I mean, have you ever coughed?
I said, it ain't working.
Have you ever coughed or sneezed and, you know? Yes. So,
Same time.
that may help.
I don't think that works for a man.
Have you ever used that?
No, I've never asked him to
Me
cough.
either.
I'm going
I
to try
bet you I
that.
will today. Tomorrow.
Now I'm going to pick up my catheter, and you need to hold it fairly close to the end because it's so pliable. If you hold it too far, when you try to put it in, the tube will bend and go down into the vagina. So hold it about right there. If you want, you can bring all of this closer. You know, you can bring the whole bag. You know, I could take it out and bring it closer to the patient, or I could leave it there, whatever makes you comfortable. So Miss Jones, take a deep breath, and we're going to go in. Push upward as you're trying to insert this because it has a tendency to want to slide downward. How far do we go in a female? 2 to 3 inches. Once you see urine, I'm going to go 1 more inch to make sure I'm not inflating it in the urinary bladder. At this point in time, my sterile procedure is over. I've got urine coming back, catheters in the bladder. Okay?
Ms. Clark, I'm sorry to interrupt, but if you go 2 to 3 inches in and you don't see urine, at that point, would you go a little bit further?
I would. Okay? I'm in, so I'm now going to take my contaminated hand, let go, and hold the catheter. If I let go with that hand, the catheter can slide right back out, and it will. So I'm holding it now with my non-dominant hand so I can inflate the balloon. Now these mannequins, I'm having to insert it into the vagina because it won't go in. And what did I say about holding your thumb right there?
Take it off.
Don't let go. Because see how it starts coming back immediately? So once I'm holding that thumb in, I'm going to give it a little tug with my non-dominant hand. Then take this and detach it. All right? We are now finished.
Yay.
So now, huh?
Great work.
Now I'm going to take, you see how this has a normal curve to it? That's designed to coil on the bed. I'm going to take my bag, and there are hooks on the side of the bed. I'm going to hang it, and you want to make sure that the tubing does not loop this way so that I can coil this on the bed. See how I've got it so there's no, so the urine will kind of go in a spiral down into the bag. If I need to get a specimen, I can get a specimen out of the bag right now. Anytime after right now, I can't. If it's 3 hours later and the doctor wants a specimen, I have to get it out of the port.
Why?
Huh?
Why?
Because urine will start growing bacteria in there. Yes, sir.
Now, how would you get it out of the bag?
Out of the bags.
Does you got one of those twist things?
There's so many different ways. Some of them have a little switch that goes side to side.
Twist.
Some of them twist. This one happens to be, and I'm not sure what y'all's is. I want to say it's a little dial thing. This one, you push your thumb up and it uncrimps it.
Okay.
So you let it drain into a urinal or one of those cylinders. If you need a specimen, into your specimen bottle, and then
Oh, you're
snap it back.
saying you can use that whenever it's full to put it in
To empty
cylinder.
it.
Yes. Okay.
Right. Okay. And then you can clean that off with an alcohol swab and put it back in there's a little sleeve right there.
Ms. Klauber, go on her point, when she says when it's full, of course, if it's full, you wouldn't know, but if you work with whatever agency's gonna have, are they gonna have their own policy? Or is it, cause you know,
Yes.
we do it every 6 hours.
Right.
But, I mean, of course, if it was full, they would say, go ahead and empty it and then add it to whatever you
Oh, you're
document
fine.
later. But I was just curious, is there a specific time that's good?
No. Usually once a shift. Usually you do it at the end of the shift. Very rarely, unless you have an irrigant, this is not going to fill up in one shift. Because that would be 6,000 cc's of urine in a shift. That would,
There'd be a problem.
there would be a problem there.
So when I come in, I'm assessing my patient that's already got this. I'm going to look to make sure the skin around this area is good
And the bed is right.
and that they actually have urine.
Right.
Usually
That's-
when you come in the morning, somebody's gonna have emptied it before you assess the patient.
So I'm gonna look
But
make
you
sure
want to
people
look
have
at it because I'm sure you've been in a room and we had a patient at the nursing home and his urine looked like iced coffee.
Ooh.
Wow.
What was that?
I don't know why it was that
It's some
color.
kind of medicine that'll turn it pink.
Yeah.
Yep.
Orange.
Orange. Yes, ma'am.
All of ours, like on the 11th floor, they were just like that, but all of ours in the unit have a meter on them. Is there is there a certain patient that requires a meter or?
Usually they have those with the intensive care because it can measure very small quantities.
Okay.
Like hourly outputs,
Mhm.
we can measure 3 cc's
Mhm.
on those. Whereas this, 25.
Okay.
So we would have to be draining it every hour.
And like we were allowed to empty those, but as far as the meter is concerned, only the nurse can document their meter reading and
Because
empty it
that's
into the bag.
measuring your urine output. That's what it is.
Right.
Never knew.
The
I just
real
didn't
urine
touch it.
output. And it's
That
just a
one
little
you
hole
can
in
just
the back.
measure small quantities. Okay? Any questions about the insertion? Now let's say 3 days later the doctor writes an order to remove the catheter. Now as a student nurse you will be allowed to you'll be allowed to put one in with an instructor present and take one out. To take one out, what do we need to take to the room with us?
A needle or the
Syringe.
Syringe.
a pad.
A Chuck's
Yeah,
pad
Chuck's pad.
or a towel or something. We should not have a lot of
No.
urine right here. And clean gloves. And I like taking a paper towel. Okay? Or a tissue. So you're going, first thing I like to do is to empty the Foley bag. Go ahead and empty the bag and get your final output. So that once we have this out, all we have to do is throw all of this away and we're not having to worry about handling all of this and emptying the bag before I can throw it away. That makes sense. So I empty the Foley bag and then Ms. Jones, I need put on my clean gloves. I'm going to identify my patient. Ms. Jones, the doctor has written us an order to remove your Foley catheter. Will it hurt? No, ma'am, it should not hurt. You let me know if you have any discomfort. If they have, it may have a little burning coming out, but it truly should not be uncomfortable.
Just a little pressure.
Not even pressure, because it basically just slides right out.
Feels good when it comes out.
Okay? So I'm going to take my syringe and deflate the balloon. And I always pull back on the plunger to make sure that I've gotten that balloon deflated.
Not too
Ms.
far.
Klauber, I end it and I go back again.
You know what I do? I usually, if it's, and most catheters are, you use a 10 syringe, I'll get me a 20 cc syringe. So that,
I want to make sure, I want to see that thing collapse.
yes, he wants to see the whole tubing collapse against, just to make sure there's not any. Then I take this, I take a paper towel in my hand and I hold it up underneath the patient. Ms. Jones, take a deep breath for me. Usually it slides right out, and there may be a little dribble at the end, and that's why I like having my paper towel. Then I can look at the end of the catheter, make sure everything's intact, that there's no blood or pus on the end of the catheter tip, so I can add that in my documentation. then I do this, and I can pull, just like we did with the, I can do,
We'll do that next time.
And when you're changing it,
and throw this
I know you
away.
said you don't want it to kink up, you know, because that can hurt
Please
the
take the
patient.
bag out of the room when you're done.
Yes,
Don't just
bag,
leave it in the trash can.
bag it up and take it out.
When you're changing it, getting it,